Hello. Thank you to the Alliance to End Hunger for inviting us to present on addressing the root causes of hunger, the transformational impact of an expanded child tax credit. I'm Alex from the Food Research and Action Center, and I will be joined by Reagan from the Parent Advisory Board of the Automatic Benefits for Children Coalition. We hope you'll get lots of useful information on how to advocate for the child tax credit and why it's so important to ending hunger in America. Our workshop objectives for today are that you will be able to identify the root causes of hunger, the importance of an expanded and inclusive child tax credit in addressing the root causes of hunger, why people with lived expertise need to be centered in advocacy efforts, and opportunities to support an expanded and inclusive child tax credit. Reagan, can you share a little bit about the ABC Coalition, please?
The Automatic Benefit for Children, also known as the ABC Coalition, is a cross-cutting group of national, state, and grassroots organizations. Our mission is to create a child allowance or a guaranteed minimum income for children that provides regular, meaningful assistance to families and promotes racial equity and justice, enjoys broad public support, and serves a foundation for a more equitable and inclusive social support system. We aim to create a child allowance or guaranteed income, as I said before, for children that provide families with regular and meaningful assistance. We see the expansion of a fully inclusive child tax credit as a step toward that goal. Our approach: creating a platform for sharing ideas, research, projects, and educational opportunities to advance a child allowance. Educating, strategizing, and communicating with policymakers to advance a child allowance. Uplifting family voices by bringing families and youth into the policy-making process. The ABC Coalition sees the child tax credit as a way to achieve a true child allowance in the U.S. and is actively advocating to make the expanded CTC permanent and fully inclusive. The coalition is committed to improving the CTC by working to ensure it is inclusive and reaches the children and families who need the support the most. It provides long-term care, reliable support for families, and advances racial and economic justice.
Thanks so much, Reagan. And FRAC, the Food Research and Action Center, is so delighted to be a member of the ABC Coalition. There'll be information at the end of this presentation for you all to sign up and become a member. And we hope many of you will do that. So the Food Research and Action Center is an anti-hunger organization working to end poverty-related hunger and improve the nutrition, health, and well-being of people who are struggling with hunger. We work through partnerships by advancing bold and equitable policy solutions and through advocacy, and we're delighted to be partners with the Alliance to End Hunger. So as many of you are well aware, hunger can't be solved simply by giving people food. Ultimately, we need to address the root causes of hunger. And there are multiple root causes that drive high rates of food insecurity in America, as well as poverty. And those factors include insufficient jobs with adequate wages and fair working conditions, as well as economic inequality, where so much of the growth and wages and wealth is at the top and no opportunities for people below the top to move up. It's also a result of an inadequate safety net that we really need to shore up for people when they are unable to work. Its root causes of hunger are driven by lack of quality, affordable access to healthcare, driven by neighborhood disinvestments and environmental injustices, by political disenfranchisement, and more. What we also know about the root causes of hunger and poverty is they're not experienced equally, and many people experience multiple root cause drivers at the same time. For instance, housing insecurity, as well as criminalization of the communities in which they live. And we know that all these are driven by structural racism, sexism, classism, and other forms of systemic discrimination. So we really need to address all those forms of oppression, as well as center advocacy in our efforts to address the root causes by getting people with lived experience and expertise engaged in finding solutions from the beginning. So on a more optimistic note, this is what a nation free from hunger would look like. We'd be able to address the root causes, and it would mean achieving for all economic security, a robust safety net, quality, affordable healthcare, and the list, you can look at the slide and see all we need to do to address the root causes of hunger. But if we were able to do this, we wouldn't have any hunger in America, we wouldn't have any poverty in America, and everyone would benefit. And of course, this demands that we center eradicating hunger and poverty among those groups that are most disproportionately affected by hunger and poverty, including Black, Latinx, Native Americans, and other groups that have been historically and currently marginalized. So that's a recap of a broader theory of addressing and ending hunger in America. What we're going to zero in on for the remainder of today's workshop is a transformational policy that really helped address hunger and poverty in America. And that policy is, drum roll, an expanded and inclusive child tax credit. So back in the day, which wasn't so long ago, although it feels like it was a while ago, the American Rescue Plan expanded the child tax credit in 2021. And this child tax credit expansion had a host of really significant changes. It increased the credit amount. It sent households monthly payments, and it expanded eligibility. The last piece that it did that was particularly important was that it opened up the expansion, the child tax credit, to households with children with the lowest incomes or no income. And that was because it was made fully refundable, which was a real key to making sure it reached millions and millions of more people. Now, we know that this 2021 expanded child tax credit resulted in huge benefits for families with children. And there's already a wide body of research that demonstrates its positive impacts. And I want to connect those positive impacts to how it was able to help address hunger in America. First of all, families who got these monthly child tax credit payments reported that more than 50% reported that they used the money for food. Clearly, there was a huge need to have extra money in people's pockets to buy food. It was shown to contribute to a 26% reduction in food insufficiency among households with children. And it also reduced child poverty dramatically. More than 3 million children were lifted out of poverty. So this is just an example of how we know what we need to do to end hunger and poverty in America, and the child tax credit was such policy. And sadly, now that we see that there is no more child tax credit, it's reflected in the recent poverty numbers that came out just a few weeks ago. There's been a surge in poverty in America, and that's especially the case for households with children. Child poverty rose at an unprecedented rate, more than doubling from 5.2% to 12.4%. And a key driver behind that doubling of poverty is because the child tax credit expired. So I was at a conference and I heard this quote. Unfortunately, I can't remember who said it, but it's not my quotation. And it says, "No data without stories, and no stories without data." So I just shared some of the data on why the child tax credit was so important. But I want you to get a sense of from a perspective of Reagan, whose family got this child tax credit, why it was important to her and her family, and why it helped with their ability to put food on the table. So Reagan, thank you so much for being ready to share your story. And I'm going to open with just a question for you. So Reagan, can you tell us a little bit about you and your family?
Absolutely. I always love talking about myself first and my family. So I am married, happily married, with 6 children, and 2 of them are serving in the United States Armed Services. And so one of them is currently deployed in Kuwait, and the other one is currently deployed in Africa. However, I do have 4 other children and now a grandson who are home with my husband and myself. So we are a very large, and even when you subtract some, still a very large family.
Thanks. And thank you for being the mother of people who are serving our country. Not always an easy thing to be, right?
Not at all.
Okay, well, I'm going to take you back in time. Looking back to the summer of 2022, when you were getting the expanded child tax credit, can you recount how it may have helped your family?
Absolutely. So those were times that were very stressful, very uncertain, very uneasy. Nobody ever likes to go back down that road or, even talk about what was or what we thought was or what we didn't know back in those times. They were just really uncertain times. And the one thing that I can say in our community and in our culture, and I'm sure in pretty other cultures too, very similar, food is a sense of comfort. Food is, people have always used food as comforting. And so in those times when you didn't know what was happening and you had your children at home because they had to be at home, you didn't have any choice, you wanted to be able to comfort them. And for me, because I have 2 growing boys still living in the house, to be able to feed them, so to speak, whenever they wanted to, whenever they wanted a snack or whenever they wanted a meal, because you just wanted to bring some sense of comfort into your home because we were in times that were uncertain. It was just comforting to me to know that I was able to put food in our refrigerator, put food on the table. They never had to worry about being hungry. They never had to worry about, well, if I tell mom I'm hungry, then that means she has to leave out and go to the store. And what's going to happen if she leaves? And what if the store is not open? They never had to have those kind of worries. And I think that one of the biggest reasons was because we had the child tax credit. And for my husband and myself, it was just knowing that we could depend on that. And we knew that that was coming. So if we had to make decisions regarding food, because we like, okay, we're going to go to the market next week. So we got to kind of a little bit, we don't have a lot, but we knew that in that next week, the child tax credit was coming. So it was a certainty that was needed in that time of uncertainty.
Yeah, thanks for sharing it, those remarks. And just, I think we all know how food is so central to everything we do. And during COVID, it was a really anxious time, and having at least one stressor, taken off the plate. I can hear from your comments how that important that was to not only your ability to care for your children, but to not be as stressed, worrying about the COVID pandemic and its health and economic crisis. Were you able to buy different types of food during COVID because of that?
That was, I would say, the beauty of it, quite honestly, because I found during that time and even before that time, I found always finding recipes that I would love to make. And recipes are so intricate. They come with, like, you know, fresh garlic cloves or fresh parsley, or everything was so intricate. And a lot of times, our supermarkets don't really carry everything that's in the ingredients that make up this dish. And so it's like, oh, you have to go to the specialty stores, or, the gluten-free stores. Or so. And those just weren't items, that you could that were on there ready. And they're more expensive. And that's, we all know that. Why eating healthy is more expensive, I'll never know. But having that extra income or that extra source allowed me to make healthier meals for my family. You always choose what's quick. And of course, when you have kids, there's nothing wrong with choosing what's quick. But sometimes, and especially in those times, you wanted to kind of slow down, eat together, share meals together, wanted to make a little healthier, wanted to kind of move away from the chicken nuggets and fries, which my sons hated, by the way. They wanted chicken nuggets and fries every 5 minutes. But having that extra source of income allowed me to make healthier meals and allowed me to afford the ingredients that I may not have otherwise been able to if we didn't have that extra source of income.
And we should have put as resources some of the recipes you tried during COVID, but we'll have to do a part 2 of this webinar.
Absolutely.
So on a less optimistic note, the child tax credit, despite all this evidence of how incredible it was for not only, addressing poverty and food insecurity and lots of other social problems, ended. So can you reflect a little bit on how that's affected your life with the ending of the tax credit?
Absolutely. I mean, not only did the tax credit help put food on the table, which was absolutely essential during that time, it also, filled in the gap when it came to, when they say you have too much, not enough money, too much month. That kind of filled in that gap when it came to, being able to pay your bills, or when it came to, having to buy something specific for one of your children. You didn't have to decide, should I go to the market? I have $80. Should I go to the market and spend 60, knowing that I need, socks or shirts for my son? So use that next 20, or that, that extra 20 for the shirts or the socks? Or do I buy the chicken, the beef, the meat to put food in the refrigerator and then forego the chicken? You didn't have to make those decisions. And now, since that ended, I find myself having to make those decisions again. I mean, people feel like because you're working, oh, you're fine. You're working, you get a paycheck every 2 weeks. But sometimes, the weeks stretch out further and further when you're looking at what you're bringing in and what you have to give out. And so not having that anymore takes away some of that security of being able to take care of your family in all aspects. Food is absolutely one of the biggest struggles I think I would say we have now, because we no longer have that extra source of income, and it's not coming in steadily, and we can't depend on it. So we're back to making those choices. Should we go to the market again, or no, but you get paid next week, but okay, it's Tuesday, I don't get paid till next Thursday. So now we're trying to rationalize. So it just, because we don't have that, we're back to the challenge of, how many packs of chicken should we get to last us 4 days? And then they're going to get sick of chicken. So how about we get ground beef? But that's expensive. So it's kind of put us back to where we were, which is insecure about being able to take care of our children from paycheck to paycheck.
Yeah, well, thank you for sharing that. And what your story really reflects to me is that Yes, COVID was an economic and health crisis for the nation, but for a lot of working families, uh, we've been in an economic crisis for a long time.
Yeah.
And we have these policies that can really help people take care of their kids, improve their nutrition and health. And we were able to get a lot of those passed during COVID, but we're going to spend the remainder of the webinar talking about getting a child tax credit passed and some of the features of what a good child tax credit would look like based on some of the work you and your colleagues in the Parent Advisory Board did. So can you walk us through a little bit about how you all came up with these principles for a child tax credit?
Absolutely. So our principles. The PAB is made up of volunteers from several member organizations. Our coalition has developed these principles as guidelines for advocates and policymakers in our fight for a permanent, inclusive, and transformative child allowance program. And I will just have to add right here, because we are members of different organizations and coalitions, the one thing that binds us together and kind of makes us a family of all over is the fact that we are all parents. And so we all, in developing these principles, we kind of all brought our parental expertise, I guess, but we also brought the compassion because we've all been there. So we all know, bringing these principles forward, we all know what it feels like. And so it was a joy actually to work with these people that I now call my family in developing these principles. So our first principle: all children should be eligible to receive a child allowance. Regardless of family structure, your number of children in your household, immigration status of any household member, or place of residence with the U.S. and its territories. This would include children living with non-relatives and kin caregivers, and children in and out of home placements in the youth justice or child welfare system. The second one is a child allowance should provide meaningful support to families. The benefit level should provide an amount that meaningfully helps families with children meet their needs. The benefit amount may be adjusted to account for differences in cost of living, to keep up with inflation, and to ensure that the benefit advances economic equity, especially for low and middle income households. Benefit amounts should not impact eligibility or benefits. A child allowance should be available through regular payments. The benefit should be delivered monthly by default, which, as anybody knows, that having it monthly is almost a godsend. Families should be able to opt into alternative delivery schedules that work best for them if they so choose. Being able to choose when you get it against, any other income that you get is very helpful to many families, we found. A child allowance should be available to all children with no strings attached. All children deserve equal concern and respect, and parents and caregivers deserve recognition for the valuable and critical work of raising children. A child should not be denied a child allowance based on the market, employment status of their parents, or other family members. Parents and other adults living with the child should not be subject to earnings tests, work, or other behavioral requirements to receive a child allowance for their child. As the experts on their own families, parents and caregivers should be free to use the benefit as they see fit for their families. Number 5, a child allowance should be easy for families to access with limited paperwork and administrative burdens for families. The benefit should be delivered automatically to a child's primary caregiver. Primary caregivers should be identified using reliable information already available to the government, in as many cases as possible, to minimize the need for application or claim filing processes. The administering agency should have the authority to obtain and use reliable information from state agencies for this purpose. Children should be enrolled automatically at birth. Families who are not automatically enrolled should be able to simply sign up online or in person. Number 6, a child allowance should be administered by an agency that is equipped to meet the needs of families and to ensure the benefit advances equity. The agency administering a child allowance must center the needs of the families it serves, have a documented history of working with stakeholders and advocates to build and improve systems, and use trauma-informed and culturally and linguistically appropriate practices. The agency must also have sufficient designated resources to meet families where they are. Number 7, a child allowance should complement, not replace, other supports for families. A child allowance program is an important social investment in families and children that should complement existing public health benefits such as SNAP, cash assistance, housing assistance, and others. Investing in a child allowance should be accompanied by increased investments in other public benefits and family support programs, and should in no way distract from existing public benefits. Families should not be penalized for receiving the child allowance.
So these are principles we can all really get behind. Thank you so much, Reagan, for spelling out what your research, your conversations, and your expertise laid out as what we need for a child allowance. And Liz Squibb is on the webinar helping us tape it, but she's the coordinator of the Parent Advisory Coalition. And one of the things she just shared was, so often we, the people who get paid to do this work day in and day out, start with our policy ideas, write the policies, and then engage people who the policies are going to most directly impact, instead of starting with the people who the policies impact to come up with ideas and then working that way. So it's really important that the Parent Advisory Board, is a great model of how to engage people with lived expertise, with dignity, with respect, and centering their voices in policy development. So in our last remainder of the webinar, we just wanted to highlight some opportunities for you all to work to improve the child tax credit. And one opportunity is, looking at states and how you can pass state tax credits that benefit families and are fully refundable, which is one of the key principles of the child allowance provisions that Reagan spelled out. And this is actually a really helpful, hopeful map of all the states that have recently done work to expand child tax credits. This past legislative session, I think there were 17 states that had progressive legislation to help put money into the pockets of people who are struggling with covering their basic needs. So happy to connect with people afterwards about what's going on in some of these states and how you can bring the anti-hunger lens and the anti-hunger community behind some of these provisions. So at the federal level, there is still hope that we can get a child tax credit in an end of the year tax package. The messaging is really no tax cuts or credits to corporation without getting tax benefits to families. And Rosa DeLaura has sponsored and introduced the American Family Act. This is the legislation that best represents the principles of the Parent Advisory Board. So legislation we at FRAC are getting behind. And some of the key highlights are it would expand the child tax credit by making it fully refundable, which means about 18 million children right now are locked out of getting any child tax credit or the full credit. This legislation would open that gate and help children in families all over the country get a higher tax credit, and some get any tax credit. It would also increase the minimum credit amount, so families would get higher credits. It would provide monthly payments, and it would make sure to expand to additional children. That was one of the things that the American Rescue Plan expanded child tax credit fell short in. This version of an expanded tax credit would add children who have I-10 numbers. They would be eligible, their family, they would be eligible for the child tax credit. So it's amazing legislation. Many of you know Rosa DeLauro and her fabulous outfits, but most importantly, you all know her because she is such a fabulous representative and is pushing this incredible legislation forward. So there's information here on a leave behind that you can bring up to Congress to press for the child tax credit and make it part of your advocacy toolkit to end hunger in America. Here are some resources for you to take a look at. And this concludes our webinar, or our workshop. We hope you learned a little bit more about the child tax credit, have some great talking points from Reagan and myself, and congratulations on all you do to end hunger in America. We so appreciate it, and we hope you'll join us in pushing for an expanded child tax credit.
Absolutely.
Thanks, everyone. Have a great day.
Thank you.